This is Natasha. She lives in Bishkek and has a history of substance use. Natasha recently got married and gave birth to a son whom she loves very much. But 6 months ago, her husband began to mock her and refused to let her use money. He also forced her to have sex immediately after giving birth and then began to beat her. However, no one is aware of it. Natasha is afraid of going to the police as she is on a drug user registry. She is also terrified of social services because she knows about cases when her friends were deprived of parental rights after social services had become aware of their drug use. According to the World Health Organization, 1 in 3 women experiences intimate partner violence. Women who experience trauma are more likely to suffer from depression, anxiety, and post-traumatic stress disorder, which in turn places them at higher risk of using drugs as a means to cope. Only 40% of women survivors of violence seek help, and only 10% go to the police. Women who use drugs are from 5 to 24 times more likely to experience gender-based violence than women in general. A study in Ukraine found that 66% of women who inject drugs had been sexually abused by the police. Fear of arrest and police abuse further impedes women from seeking help and protection from violent partners. In most countries in the EECA region, existing programs for women who are survivors of violence do not accept women who use drugs. For example, in Serbia, only 1 out of 16 shelters is willing to take women who use drugs, and they are open to accept only those who receive opioid substitution therapy. Stigma can exacerbate guilt and shame, while discriminatory and unsupportive services may deter help seeking. Women who use drugs are caught in a vicious circle, and seeking help instead of support leads to re-traumatization. Natasha finally turned to the police after her husband had beaten not only her but also her child. However, the police did not arrive. A couple of days later, an inspector came to her house and threatened to deprive her of parental rights if she continued to bother the police about domestic violence. Of all the social services, Natasha only had the phone number of a harm reduction social worker. But even with joint efforts, they failed to find a place in the Center for Women who are Survivors of Violence because of Natasha's drug addiction. Whoever is first approached by a woman who experiences violence should be ready to provide the necessary assistance or referral to specialists. Support services for women in situations of violence should consider each woman's experience and be accepting and non-discriminatory. Women who use drugs and undergo gender-based or police violence need to be helped, not ignored.